I was extremely anxious, especially an abdominal surgery, because of what I went through with my wounds not healing properly and getting sepsis. I was terrified of having it opened again. That was one of the reasons that I really wanted a VBAC, because of how scary the recovery was from my abdominal surgery. But I also knew that I wanted to be okay, and that clinically they had never led me in the wrong direction, and that they wouldn't be suggesting this now at 38 weeks when it had never been suggested before unless it was really important.
Giving birth is one of the most significant events of your life. Sadly, the joy that you should feel can often be replaced with anxiety and helplessness instead. As a labor and delivery nurse, I'm revealing insider information to educate you, reassure you, and decrease your fear. In this podcast, you'll hear empowering birth stories and experts weigh in on a range of topics. Being Jewish also has me exploring Judaism's influence on the reproductive experience. However, I speak to anyone wishing to navigate their journey with more joy and confidence. I'm your host, Chani Fingerer, and you're listening to the Happy Birthway Podcast. The Jewish weekly day of rest, Shabbos, is so precious and sacred. However, many women find it challenging to refrain from applying makeup on this festive day, and some are even hesitant to leave the house. Enter Seventh Day Shine, a revolutionary skincare and makeup line that can be applied on Shabbos while keeping halacha. Their foundation, blush, bronzer, eyeshadow, and eyeliner and lip powders come in a huge array of colors, and their application brushes are so luxurious. My favorite product is Luminosity, an intensely hydrating and refreshingly scented serum that's especially formulated for permissible application on Shabbos. Check out their full line on seventhDayShine.com. That's the number 7, THDAYSHINE.com, and enter Birthway10 for 10% off your purchase. Find the link in the episode show notes. It takes time and practice to master the skill of the newborn swaddle. So here's my hack. Go to elliesandco.com. Among their full line of gorgeous, high-quality baby bedding and layette sets, you will find adjustable swaddle blankets that take out all the guesswork. With a pocket for baby's legs and adjustable wings with secure closures, your baby's swaddle will be perfect every time. Go to elliesandco.com. That's ELYSANDCO.com and enter BW10 for 10% off your purchase. Link in the episode show notes. Welcome to another episode of the Happy Birthway Podcast. In this episode, we are going to be interviewing Esther Widroff once again on part 2 of her fertility reproductive journey. So, Esther, we covered your surgery and that you pretty much healed. You had more than one surgery, and it was like a process, quite the process. So did you feel ready to get pregnant again? You knew that even despite having breast surgery and everything, you were still going to continue to build your family.
Yes. Before having surgery, I had asked about that because, again, I had extensive abdominal surgery for the reconstruction, and my plastic surgeon said you need a full year to recover, to give your body the chance, the tissue to regenerate, and just like everything.
But even given all the abdominal surgery you had, it was still completely safe for you to get pregnant, and that wouldn't interfere.
No, not at all. Yeah, and it was a year from the first surgery, not the second. So the first surgery I had in June, the second surgery I had in January, actually like 5 or 6 weeks before the pandemic started. And I remember thinking when the pandemic started, like, wow, I was just in the hospital. And I still had open wounds and just like being really scared about things in general. But yes, we definitely knew that we wanted another child. My daughter was turning 4 at the time, so a nice age gap. This time we did not have the same doctors that we did when we were in New York, but again, we had Yale, and Yale's fertility center is fabulous, and they know all of my surgeons, again, because cancer patients go in for fertility treatments all the time to preserve fertility after issues. So again, the continuity of care was there, felt very comfortable, but because of the pandemic, fertility centers closed down. So it was really devastating for me. We had started everything. We were going towards this workup, and I was really excited, and all of a sudden, everything is taken away. And without a fertility clinic, pregnancy is not possible for me. And in the same time, again, my husband being in the military, there was this possibility that he was going to be deployed for 9 months. And I was just like, if he's not here, then we can't do fertility treatments. It's not going to work. it was really crazy timing. The whole world was going through crazy time.
This is just one of so many effects of COVID, where people had to put their fertility plans on hold.
Yeah, and we didn't know when they were going to reopen. They didn't know when. Around June, I'd say early summer.
This past June. So about a year ago.
Yeah, 2020. I got the call that they were reopening. Thank God my husband did not get deployed. Baruch Hashem, Baruch Hashem, Baruch Hashem. So we started fertility treatments and elated that it worked on the very first time. And my HCG, so for people who get pregnant naturally, and they don't have to worry about these things, they probably don't know about HCG trends or repeat betas or anything like that. But with fertility treatments, typically they track your HCG over the course of 48 hours, and the typical trend is a 50% rise over 48 hours. That's what we're looking for.
So HCG is the hormone that sustains pregnancy.
Yes.
It's the main hormone. So they do very accurate, very specific and thorough testing of different hormones when you're having fertility treatment. So this is one of the key
And this is the
hormones.
first sign that there's a pregnancy. So of course I couldn't resist. I took a home pregnancy test and got a positive. So I knew I was pregnant, but then starts is the HCG going to be right? And Baruch Hashem, the HCG did rise appropriately. It was actually extremely high, steadily. So we were really excited. Everything was great. I actually went in to the doctor again, with fertility treatments, you're seen a lot earlier than you otherwise would be. So at 5 weeks, I went in for my first sono, and thank God there was a sac. No baby or fetal pull yet, but it's still too early. That's all we're looking for is a sac. At that point, they stopped testing your HCG because it's irrelevant, and it tapers off at a certain point. It stops doubling. So I was being monitored, and I would say a week later I started bleeding and freaking out because, again, I have a lot of experience with loss. Even though there are many reasons that people bleed for good reasons, when you've had miscarriages, you immediately think the worst. My doctor had me come in immediately, and there were actually 2 sacs. So we found out that there were twins. Unfortunately, the sac that was scanned the week before had stopped growing, but the second sac still looked viable. So I was sent to Yale's maternal fetal medicine because their sono machines are much more in depth, just to get a good read on what's going on with that second sac. So we started Friday finding out that we were pregnant. By the following Friday, it was, oh, you're pregnant, you're having twins. One of them's not viable. And then by the end of the week when I had the second sono, we found out that the second one wasn't viable either. So it was a miscarriage, and it was really devastating. Again, all of them are. But this one was especially hard for me because it was my first miscarriage since having sorrow, where I was actively pursuing fertility treatments and desperately. I'd wanted another child for several years already, but because I had to recover from my surgery, everything had to go in the back burner.
It was like that circumstantial fertility we talk about, where maybe biologically you could have had fertility treatments, but because of the circumstances of your other surgeries,
I couldn't. Right. So it was really difficult. And again, because we were still, things were lessening pandemic-wise, but we're still very much in the pandemic, I had to go to all these appointments alone with my husband on FaceTime or over the phone, and then come home to my daughters, who I love very, very much, but there was no personal space to mourn that loss at all. And now, because I had just turned 30, I'm getting closer to needing these gynecological surgeries that would make it impossible to have children. So there's this fear of, am I going to ever get a second chance at a third child? So again, we waited for the HCG to fall down to 0, and when it finally did, I met with my doctor again, and after failed cycles, and this is still considered a failed cycle because of the miscarriage, you sort of have the what happened appointment, what went wrong. And a lot of times there's nothing to say what went wrong. We don't know, especially when I was on all of the supportive medication that I should have been taking. But he said, you know what, let's try again. You do have this window of time, but you're still young, you're still healthy. Let's jump right back into this. So we did. We waited 1 cycle in between and then started again. And thank God we got pregnant with Sev. And actually, it's really funny timing-wise, because if you remember last summer, we had that power outage here I don't know if Blue Ridge did. We lost power for a week.
Not just did we have that, my husband had emergency surgery.
Oh, right, at the same time. That's
I will
right.
never forget that power outage because it just complicated things that much more.
Exactly.
So, yeah, we had a power outage for about a week. It was
horrible.
Yeah, a lot of places had it. I know Passaic had it. I know Riverdale had it.
It was just bad. And there were no hotels to go to, and we couldn't leave because with the pandemic, my husband was on travel restriction. The military was super strict about where you could go and not go. So, like, I couldn't even, and it applied to family members as well. We couldn't leave the state legally. It was horrible. But the Sunday of that power outage, it was about 8 days past the treatment. And I took the first home pregnancy test, and it was a faint positive. And I remember, again, this like dichotomy of, oh my God, oh my God, oh my God, but also so scared because I was still very much suffering emotionally from the loss. But went to the doctor, did the repeat betas, everything was fine. But again, my betas were fine with my last miscarriage before. So there was no comfort. There was no finding that comfort.
It's like a glimmer of hope with a lot of trepidation.
Absolutely. I would like to say like cautiously optimistic. And didn't want to tell anyone, like not even our family, because they just, like they knew about the one before and I didn't want anyone worrying about me. It just was a lot.
Yeah, it's probably also hard to like disappoint people all over again. It's not just you, and
right.
You have enough to deal with. You have enough emotional baggage to deal with, and then just having to call other people and disappoint them and tell them too. And
yeah, right. It's a lot. So we didn't say anything, and time slowly trickles on. It is the longest, I would say.
I remember you were telling me, and it was slow for me. I was davening and like hoping for you that it would take, and oh my gosh.
Yeah, definitely. So we had the first Sano, and the sac was there again. And at this appointment, actually, even at 5.5 weeks, there was also a fetal pole, which is the first sign that a baby is developing. So that was amazing. It's more than what they wanted to see. They're really happy. Went back a week later and heard the heartbeat and saw the flicker for the first time.
Wow. And you didn't hear the heartbeat with the last loss, right?
No. And statistically, the loss after a heartbeat, it drops significantly. It's still there, but it drops significantly.
Before there's a heartbeat, that's considered a chemical pregnancy, yes, where it's not really a clinical pregnancy yet. But once you hear the heartbeat, that's already a clinical pregnancy.
Yeah, it's like the first sign of life.
And so statistically, the chances of loss are much lower.
Yes. So that was incredible. And actually at that point in time, because of everything that I had gone through, Yale was allowing certain spouses to come in, and they would basically make your appointment when no one else was in the building. And my husband was able to come into not the first one, but the second appointment, because again, things were lessening. They're allowing in more people. So he was able to come in, and that was a huge relief for me because, you know, my previous experience was finding out all by myself that you're
traumatic.
having this. Yeah, it was hard. It was really hard. So basically you stay with the fertility clinic until about 10 to 12 weeks, depending, and then you graduate and get to go on to whoever's going to deliver you. Because I have such a history of loss and complicated pregnancies, I was monitored by a high-risk practice at Yale, their maternal fetal medicine department.
Which is such an amazing team, I have to say.
Oh, amazing.
Yale is one of a handful of hospitals in the U.S. that has a dedicated, 16-bed, I believe, high-risk maternal special care unit. It's just, amazing, the things that I've seen when I worked there. So, yeah, again, you had great messengers and you were in such great hands.
Like I said, Hashem really puts you exactly where you need to be. Incredible doctors, and really feeling every step of the way that they were in it too. They wanted me to have this baby as much as I wanted to have this baby. And I developed HG again, which we knew. They say that it's genetic, that most people who have it with one pregnancy have it with all pregnancies. But everything was really great otherwise. We were hitting every single milestone exactly as we should. He was measuring perfectly.
When did you start telling people?
I don't think I ever officially told people because I was still so scared. I was so scared. And my husband's a clinical psychologist, so he deals with emotional wrecks on the regular. And I used to cry to him every night. And literally, I'm not exaggerating, every single night I would have a moment where I would just cry and say, what if I never get to hold him? And that was a very, very real feel through the day that he was born.
And that's so special. You knew he was a boy, right?
We did find out.
After two girls.
After two girls, we found out that he was a boy. And it was. I mean, we ended up telling our daughters, I would say around 17 weeks. Because I was so sick, my older daughter, the 8-year-old, she was convinced I had corona and was dying. And she expressed this to my husband, that she was really worried about how sick I was. And my husband said to me, I know you don't want to tell anyone, because if you talk about it, it makes it real. And once something is super real, that means that loss that you experience, chas v'shalom, if there is one, is real on a whole other multitude of levels. It's not just your loss anymore. And some people find comfort in that, and that's fine. Again, all of this is so highly personalized. I personally...
But I can imagine, on the other hand, it could be very emotionally burdensome.
Yeah, because a lot of people don't know what to say, and they don't know what to do, and then it's just awkward. So we told our daughters, and my 8-year-old immediately started crying, and she said, Hashem answered my tefillos. And my immediate reaction was oh my gosh, my daughter is so cute, and she's so from. But she expressed, being 8 years old, she's able to express these things, that she has been davening for a very long time, and that she was just so happy. And my 5-year-old was she had given up all hope, because by kindergarten, almost every other kid in her class had a baby, if not 2 more below them. So she just was hey, okay, she didn't think much about it.
So I think also it must have been so special this time around. I remember with my kids, when I had my 3rd and my 4th, they were older, so they can understand better. Sarah was probably too young to really understand everything with Perry.
She was 2 with Perry. She was when Perry was born, Sarah was turning 3. She was a baby still.
So it's a whole new experience, that excitement.
Totally. I had a 7-year-old and an almost 5-year-old. And Sarah was very what do you need, Mommy? How can I help you feel better? Perry would bring me a trash can, whatever. They were both very excited.
That took away their worry.
It did. They wanted to tell the world. And I had to explain to them. I said, the same way that we daven for a baby, other people may be davening for a baby too. So we're not going to talk about it, because, we don't want to make anyone feel bad, which is the truth. I never want to make anyone feel bad. And I had friends that were suffering from infertility at the same time. And there is this guilt, but again, it's a weird place to be in, because at the same time, I'm terrified that I'm never going to meet my baby. So it's not all ecstasy anymore. It's not. It's very scary.
Mm-hmm. Yeah, I talked about this with Amy Barron.
She's incredible.
A few episodes back, about how pregnancy after infertility is really not...
It messes with you. Mm-hmm. It's really not. It's not. So we told our kids, and then around 20 weeks, I went in for my anatomy scan. And because I'd had preterm labor with Perry, they did a routine measuring of the cervix, and my cervix measured short.
Which means you're at much greater risk
for preterm labor again. Mm-hmm. And it was so significantly short that they were going back and forth if they should do a cerclage or not. And
a cerclage is a stitch to sew up that's placed in your cervix that will hopefully decrease the chances of preterm labor, but you have so much of a window. It's a really small window of time you have to actually put it in.
Right. They won't do it after 23 weeks. And they were also nervous about when you do it, you run the risk of triggering labor because you're messing with the cervix. So in the end, they put me on progesterone, which also is shown clinically to stop labor. We did not do the cerclage because that window sort of closed, and they felt from 20 weeks to 21 weeks, my cervix was stable, and from 21 to 22, it measured a tiny bit smaller, but nothing major.
So there's risks and benefits to anything. Both. Yeah. So they were weighing the two and just taking whatever information they could to calculate what the decision would be.
Yeah, absolutely. And because I had done fertility treatments, progesterone is a normal part of that also. So they knew that I was capable of doing it correctly. So we did that.
Because they're shots, right?
Yeah. So you can do PIO, which is progesterone and oil, or you can do a suppository. I ended up doing the suppositories because the progesterone and oil is really, really painful. It's really a thick serum. It's not fun. So we did the suppositories twice a day, but I was told to go on to not full bed rest, because there is information that full bed rest can also be a reason of preterm labor. So basically, beforehand I was in Mora and I was chasing after little kids, and my doctor is just like, you can't do that anymore. You can't be on your feet all day.
Decreased activity.
Yeah.
And I want to put it out there that with Perry, you were told to be on bed rest. And the more time passes, the more information we get through research. So now we do know that it is important to move around to an extent.
Absolutely.
Even for reasons like your blood is at higher risk for clotting.
Yeah, circulatory.
Exactly. So we don't want you to stay still for too long, because that can actually cause deep vein thrombosis, which is a blood clot that can go to your heart that can be really dangerous. So at this point, the recommendations changed and you were told to do partial bed rest.
Right. I was told, if you're in bed for a couple of hours and get out of bed, move around, go to the bathroom for sure. Like, it's okay to go outside with your kids. Just don't be out of bed doing strenuous activity for hours at a time.
Don't run marathons and
Yeah,
stuff.
exactly. And I was having some pretty strong Braxton Hicks that turned into some real contractions, but for the most part, it was pretty okay. Nothing. I wasn't dilated at all at that point.
So huge ups and downs once again. Besides for the HG,
yes.
the partial bed rest, the fear again that you're gonna have preterm labor, and I think that up until you get to like 28 weeks, somewhere between the 22 and 28 week mark is a really hard time.
Very. I was texting you a lot at this point. I remember so specifically when we passed 28 weeks, saying like, you breathe a little bit, because even if you were to deliver, the NICU stay is substantial, but it's not as fighting for life as if you deliver at 25 weeks.
The statistics of survival are much higher, and the statistics of any like cognitive delays and developmental deficits are lower at that point. Whereas somewhere between 22 and 28 weeks, it's kind of like your baby can possibly survive, but then live a life with a lot of difficulty and hardship and making really difficult decisions. So past 28 weeks is like good, and then every like 2 weeks is another milestone.
Yeah,
right?
Absolutely. That's exactly what it was. Went from 28 to 30 to 32 to 34. And thank God time went on and kept passing, and each week I was like, I made it another week. I did start dilating around 31 weeks. I think I was a full 2 centimeters. And continued to efface a little bit more. So then, we really thought this baby is coming sooner rather than later. And then it was Pesach time, and I was 36 weeks and about 3 centimeters and almost fully effaced. So we thought for sure this baby's coming. And at that point, I'd been taking off the progesterone at 36 weeks, because if baby comes, that's totally fine. Really, again, a lot of gratitude to God for keeping him inside of me as long as possible. And at that point, I was so ready for him to come. I was so ready.
Especially being told he's going to be here early.
It felt like he was so late. Yeah, if you're being told statistically, they can, there's some formula that the measure of your cervix can predict when you're going to deliver. So where my cervix was measuring at 20 weeks predicted that he would be delivered sometime between 30 and 34 weeks. So now we're at 36 going on to 37 weeks.
And again, so little that we know. Right.
Yeah.
So little.
I mean, and I felt amazing that, thank God, I kept him in. My second child that I was told was going to be delivered early and didn't. So now I was really ready for him to come out. And after Pesach, went to the doctor, just regular checks, and he's fine. And I thought they were going to say, yeah, we're ready to go. You've dilated more. I was having so many contractions. The second Seder, I thought for sure I had to go to the hospital. I was having contraction every 7 minutes. They were getting harder and stronger. But I wanted to put my girls to sleep first. So I was like, after they go to sleep, then we're going to go to the hospital. And I sat down on my daughter's bed, and I ended up like sitting there a little longer than usual. And because I sat for so long, the contraction stopped. So we did not go to the hospital.
And that was kind of like, I think, that pattern in your whole entire pregnancy of like, okay, contractions are starting. Yeah. Now I need to rest. Okay, contractions stop. Yeah. Will they stop? Okay, they stop. Yeah. And just to clarify, because you had a successful VBAC, the plan was another VBAC. And statistically, the rates of a successful VBAC go up once you've already proven.
They never even mentioned C-section to me. Mm-hmm. It was never mentioned. Which I really liked, because my experience with my VBAC was a lot better than my experience with my C-section. Obviously, there are some people that say that they like their C-sections because they go into it knowing what to expect and what the recovery is. For me personally, I recovered a lot faster from my VBAC than my C-section. It just night and day difference.
Statistically, that's how it is.
Yeah. So the plan was a VBAC. At this point, they had started doing non-stress tests once to twice a week just to make sure that he was okay.
Non-stress test is when they basically just come in, they put you on for at least 20 minutes, look at the baby's heart rate, different characteristics. If baby meets criteria, then we know that your baby's doing well.
Right, exactly. So it was a Monday morning? No, a Tuesday morning. It was a Tuesday morning. I had gone in for my non-stress test. And he did great. He passed within like the first 20 minutes. But they decided they wanted to do a growth scan because we're going for this VBAC. I had, again, intense abdominal surgery. Just want to make sure that everything's okay.
And you had so much weight. Did you lose weight?
I lost a lot of weight.
During the pregnancy, you weren't even eating, right?
Yeah, I lost a lot of weight during this pregnancy that like I couldn't even imagine how the baby had anything because I had lost so much weight from being so sick.
And it's incredible because our bodies are still capable of providing nutrition for babies.
Is a testament to that. Yeah.
Exactly. So it's amazing how our bodies can work.
Right. So at this point I was 38 weeks and change. And just because of my history with delivery, they decided that I was a good candidate for induction at 39 weeks. And they even said that it wasn't even going to be called like a real induction because I was already 4 to 5 centimeters dilated and 90% effaced. The plan was just to start some Pitocin and, baby would come right out. They wanted to do a growth scan though, just to see how he's doing again, because I had lost so much weight and I hadn't had a growth scan in quite a while, probably like 8 weeks or so. And again, because of all of the weight loss, they need to make sure our baby's okay. So they did a growth scan and he looked great. But I knew that something wasn't right because the technician said, just hold on a minute, I want to show the pictures to the doctor and we'll be right back, which is normal. But they also usually normal say you can wipe off and get dressed again. And she didn't say that to me. So I knew that he was okay because I saw his heart beating and I saw that his measurements were normal. But I also knew that something else must be going on. And then lo and behold, the doctor walks back in. It was Dr. Olga, who you know.
I love her.
She's incredible. And she started rescanning certain parts. So then I started getting a little bit nervous, what's going on. And she turned to me and she said, the prediction is the baby is 8 pounds, 13 ounces. And I was
no worries about growth here.
No worry. I was like, how is that possible? I lost almost 20 pounds in my pregnancy. So I thought maybe that's why. And then she looked at me and she said, we need to talk about a couple of things. And I was like, okay, this is why. And she explained to me that there were some irregularities on the sono, not with the baby, but with my placenta. So like, again, you breathe a little bit easier. It's the placenta. I'm already 38 weeks, so no matter what's going to happen out of this, we're going to be okay. So she showed me on the screen that there was this like large cloudy black area, and she said, this is blood. It's coming out of your placenta. There's partial abruption. We don't know what caused it, but basically when your placenta completely detaches, that the placenta is the nourishment to the baby. So if it's not attached to you, baby's not getting nourishment. And then she said, and look over here. She's like, this is called placenta accreta. It's the opposite of placenta abruption. It's when the placenta digs really deep into your uterus.
It invades your uterine tissue.
Yeah. And she said, these are both dangerous conditions, but the accreta is what we're really worried about, because if you were to deliver vaginally in an uncontrolled situation, there's the possibility of bleeding out and dying.
Right.
And she said this is actually a really hard condition to clinically diagnose. They don't always see it because at that point in the pregnancy, the baby takes up so much space that she said actually the placenta abruption, the blood that they saw, is what got them looking at the placenta. And really is what helped them figure out. Like, if there wasn't that blood there, they wouldn't have known to look that deeply.
And I want to mention that placenta accreta is something that has a higher rate with each C-section because of the scar tissue, and this is one of the reasons why we try to avoid a C-section, among others. It also can cause the need for a total hysterectomy.
Yes. Because
if it doesn't separate from the uterus and it invades it, and it can actually go past the uterus and invade other organs.
Mm-hmm.
Yep. So we do worry about that greatly. Either way, it's removed surgically.
Right.
So vaginally, if it doesn't detach, it can cause tremendous hemorrhage.
Yes.
Yeah.
And actually, it's interesting that I didn't mention with Perry, after she was born, I did experience a hemorrhage. So when they went back, they actually looked at my medical records from NYU, because through my chart. They can access everything. And apparently there was a note about my uterus not contracting properly to deliver the placenta, which caused the hemorrhage. So anyways, she said, we need to have a really hard conversation. And I said, I know exactly what you're going to say to me. You're going to say that a C-section is my best option and the safest option. And I said, and I'm not going to fight you because I didn't go to med school. I'm not a doctor. And there's no way that I've just gone through literal hell and back to get on my high horse if I want another VBAC and I don't want a C-section and then risk bleeding out. And now what? My husband's left with 3 kids that I'm not going to be. I said, I'm not fighting. That sounds great to me.
And you trusted her. You had
absolutely.
A great team. And you even said, I think, to me, where she really gave you she didn't say you have to.
No, she didn't.
You must.
Nope.
She just left it up to you, explained to you
yes.
the risks and benefits of both.
Yes, absolutely. She did not tell me.
But that a C-section, in her clinical opinion, would be safer.
Which is, I think, a doctor's role is to give us the clinical opinion and the expert opinion. So she did not say you must have a C-section. She said, these are the risks if we VBAC. And the risks were scary, including bleeding out, and then, as you mentioned, needing to be immediately rushed into surgery to have your placenta and possibly uterus surgically removed. Whereas in a C-section, it's a controlled environment. They go into the surgery with the medication necessary to treat this condition, or to help the uterus contract if it's not doing it on its own, with blood bags already hanging as opposed to needing to rush it up from a blood bank.
They're also in there so they can see firsthand exactly what's going on.
Absolutely.
And they can remove the placenta manually.
Yes.
Where they can't do. And I think at this point it's important to note that a vaginal delivery could have had real significant risks in your particular situation.
Absolutely.
So we aim for a VBAC when we think that someone's vaginal birth would be
successful,
less complicated, have less complications. And at this point, it was really determined that your vaginal birth may have had more complications than a repeat cesarean.
Mm-hmm, absolutely. So I agreed with them. I was sent to the hospital for a pre-op physical, and I was told to come back the next day at noon for a C-section. They did say if I start bleeding at any point to come back immediately.
Were you, given your past history of all of the breast surgeries that you had, were you anxious about another surgery?
I was extremely anxious, especially an abdominal surgery, because of what I went through with my wounds not healing properly and getting sepsis. I was terrified of having it opened again. During sepsis, they cut it open, and then during my revision surgery in January, they cut it open again to revise how it looks. So it's 4 times being cut open in the same spot. So I was really nervous about it, and that was one of the reasons that I really wanted a VBAC. Because I just didn't want my skin getting messed with again and my tissue, because of how scary the recovery was from my abdominal surgery. But I also knew that I wanted to be okay, and that clinically they had never led me in the wrong direction, and that they wouldn't be suggesting this now at 38 weeks when it had never been suggested before, unless it was really important.
You didn't have doubts, which I think is so important, that you didn't have doubts, and they never forced you into anything, and they just really monitored you and had your best interest in mind.
Yeah,
that's amazing.
Absolutely.
And probably once again, time passed super slow from
one day to the next. Oh my goodness. My kids were really excited though.
So they knew you were going to have the baby.
They knew that I was going into the hospital again, just because I'd had surgery in the past, and my daughter is my older one is a little bit more prone to worrying, and I knew I wouldn't be coming home that night. So we did say, we're going in, we're going to have the baby, Mirza Hashem, today. My father, who's very, very close with my kids, came to take care of them. And they were super excited about Camp Zadie and all of the candy that he brought. They were on cloud 9. I went in, and the surgeon came in and explained to me, even though I'd already had a C-section, they have to tell you everything again. And then they talked about the possibility of a total hysterectomy. And that was a little, scary, just because a hysterectomy, that means that really your chapter of having children is over. You don't necessarily need your tubes to have children. You don't necessarily need your ovaries to have children if you've already stored embryos. But you need your uterus. You need it. So
even I hear from people who didn't plan on having another baby, when they had a hysterectomy, it was just still devastating.
It is. It's devastating. And it's funny because Emotionally, when I lost my breast, it was challenging, but not anywhere near as the thought of losing my uterus. And at the same time, it had been discussed that, you know, again, I have this threat of ovarian cancer and I need to do fertility treatments for kids anyways. So they had mentioned, you know, one risk-reducing surgery would be to have your fallopian tubes removed because that's where ovarian cancer originates. So if you don't have the tubes, it's risk-reducing. So I had said, you know what, if I end up with a C-section and you're opening me up anyways, then let's remove my tubes because then it's one less thing I have to worry about. So that also became a reality of I definitively would be losing my tubes. And that was hard to swallow. Also, again, not even that they're necessary, especially in my position for having children.
It's just another body part.
It is. And also, you know what? It's. I felt like it was like connected directly to womanhood. And as you mentioned before about how the Torah says we don't harm our body, there's like very strict halachos about not doing anything to your reproduction. Yeah. We ask shilas, obviously, and the shilas, you have to do this because of pekuach nefesh. But yeah, it was a tough pill to swallow.
Yeah, pekuach nefesh means, you know, saving a life.
Preservation of life.
Preservation of life, exactly. So when it's determined that this is a procedure that would preserve life, even though it comes with risks, then that's what we do. It
trumps out the other rule that says you can't do this.
Exactly, yeah.
So we went into the OR, and I have to tell you, it was such a different experience in my first C-section. It was like night and day. Everyone was so relaxed. And you had actually called the hospital, or a friend of yours, from when you were at Yale, and we were greeted like celebrities with open arms, and they knew our names. And one of your friends was in the OR with me, and she held my hand and calmed me down as I put in the spinal, and they put on music, and everyone was just so chilled. And I was like, okay, I get it. This is why people do repeat C-sections. In a non-emergency setting, it's a totally different experience. They started the C-section, and they confirmed their fears that there was full placenta accreta. They had to use some different techniques to get the placenta to detach, and treated it with like medicinally as well as manually. Zev was born. He did weigh 8 pounds 13 ounces, and
he cried right
away. And they brought him to the warmer and cleaned him up a little, did the Apgar, and then they brought him over to me, which was incredible because with Sarah, I did not get to see her before she went to the NICU. Whereas with him, they did skin to skin immediately in the OR. And I remember just crying and thanking God that he's here and this is my baby and this is the one that I worried about every single day. And it was truly incredible.
So you did skin to skin, and this time around you didn't have breasts to breastfeed, and you breastfed your first 2, correct?
Yes, I did. So that was a totally different experience. Even though physically I look totally put together because I was reconstructed, I don't have mammary glands or anything like that. So breastfeeding is not an option. So he has been formula fed from the start. And even in the OR, they say that like babies should feed right away, especially bigger babies, so that they can maintain their sugars. So it was just like, I was like, I don't know how much to feed him. How many ounces does a newborn eat?
And I know that you had some anxiety beforehand, right? About how would they treat you? Would they judge you?
Yes, because Yale is a baby-friendly hospital. So is NYU, where I delivered my others. And they're very, very pro-breastfeeding. So I was very nervous about, are they going to send in a lactation consultant without even asking me? Because I literally can't lactate. It's never going to happen. And would I be judged?
Right. Yeah. Just that sensitivity of this is just yet another hard experience, a reminder of what you went through.
Yeah. So I was really, really nervous about that. We spoke about that a bunch of times, to the point that even before I had Zev, I had mentioned to my provider, and she said that they always, like in your file, they add notes. And one of the notes was, to be sensitive to this and to make sure that every nurse who comes in contact with me is aware of the situation. Thankfully, they were actually really, really well aware of it. And it probably has to do with the proximity to Smilo again. We're under the Yale umbrella. No one said anything other than encouraging and supportive words about it. So we formula fed, and he's doing great, and he's thriving. And he, again, is my third living, breathing miracle baby.
He's so beautiful. And before we end off, I just wanted to give that little anecdote of what happened post having him with your surgical incision. An adventure we went on together.
Yes, we did. Of course, my biggest fear was an infection.
So you were really looking out for that very closely, given your history.
Closely. Yes. His bris, obviously, was 8 days after he was born.
Which was so beautiful.
Yes, thank you for being there. 2 days later, I realized that there was some leakage from the incision, and it was warm and red. So I was told to go back to the hospital.
So and you were well aware of the symptoms of infection.
Yeah, and it was clearly infected. And you took me because my baby had just had a bris, so couldn't put him in the car seat, and my husband stayed home with him, thank God. And when we got to Yale, they said no visitors. And by the way, I don't think I told you this, but there was someone in one of the beds next to me, and her sister was a doctor in a different department in the hospital, and she got kicked out of the ER because they did not allow visitors.
Yes, well, my husband had emergency surgery last summer at Yale, and it was the same thing. Like, the security guard in one department said, I'm sorry, I can't go into the other one. They don't let.
Yeah, they're very strict. So I went, and thank God my surgeon from my C-section was able to come down to the ER and look at the incision and say definitively this is very infected. And they determined that the reason it happened is just my skin was so friable from being cut open and sewn back together so many times that it didn't heal properly. So I ended up again packing a wound.
But thank God it wasn't septic. You weren't.
No,
it was not an advanced infection.
Not at all.
You caught it quickly because you knew what to look out for.
Yes, exactly. Because I knew what to look out for from my past experience. We caught it really early. They put me on antibiotics and just kept an eye on it for a little bit, and it healed perfectly fine. I didn't have to stay in the hospital.
Thank God. That was such a relief.
It was so traumatic. It was such a traumatic day. And again, this whole time I'm thinking, like, do I really need to check off every box of drama? Like, when is it going to just be boring? I just want boring. But I feel the more you say you want boring, the more Hashem is like, let's make things exciting. But again, at the end of the day, everything healed normally. And Zev is great. And I feel great. I actually, after that minor setback, I bounced back faster than any other pregnancy that I've had in delivery. Like, even with Perry and my VBAC, it still took a couple of weeks to feel normal again. Like, after like the antibiotics started and like kicked in, it was like I was up and walking around. And my in-laws actually made a kiddush for my niece, and everyone was like, why are you up? And you even said at the birth, like, why are you up and walking? And I'm like, I can't sit down. I've been sitting down for too long. Yeah. So now we're great.
You were glowing. You look so beautiful by that breast. I mean, you still do. I'm so happy that you're healed, and you're such an inspiration. You talked about topics that are sensitive and not easy for a lot of people to talk about. And I'm sure so many people listening to this, either themselves or their loved ones, have gone through some similar difficulties to you, and I hope that they draw strength. Thank you so much, Esther, for coming on. I'm so happy that you're healed and that
Thank God.
You're past all of that and it's all behind you, and you have beautiful, beautiful, 3 healthy, beautiful children. I hope that you enjoy them, and no more drama.
No more drama. Thank you.
That's it.
It's my pleasure.
Thanks for tuning into the Happy Birthway podcast. Head over to Yoledet Academy on Instagram to continue the conversation. You'll find the link in the episode show notes, as well as links to any additional resources, products, and services mentioned here. If you love listening to this show, you can help it grow by sharing it with your friends and rating and reviewing it. To stay in the loop when new episodes are released, make sure to subscribe. Remember that your health needs are unique and require individualized medical advice. The podcast is not a replacement, and some of the information may not be appropriate for your specific circumstances. My mission is to educate you so that you can confidently collaborate with your healthcare team. I believe that a healthy mom and healthy baby are simply not enough. We also need a happy mom with an empowering birth experience.